conversation.
We always do a selfie.
Oh, do we?
Oh, yes.
Oh.
Whatever. Try to do.
Are selfies a one, I guess, maybe, hey? It's just, yes.
Somebody told me they're actually called ussies, because it's us.
As opposed to a selfie.
I don't know. Nope. Our comms person's saying no.
Ussie.
Yeah.
Glasses.
There we go. Thank you.
That's that.
That's that. Hi there, I'm Brenda Merritt. I'm the Dean of the Faculty of Health here at Dalhousie University. And thanks for joining us for another episode of the Dean's Dialogue. Today I have Dr. Derek Rutherford, the Director of the School of Physiotherapy, with me. And as you can see, we've flipped the script a bit. I'm in the hot seat, and Derek is going to be interviewing me today. So welcome, Derek. Thanks for being here.
Oh, thank you, Brenda.
I'll just turn it over to you.
All right, fair enough. So, a list of questions. I'm going to start sort of going back to hearing of your origin story. So I understand you're from Colorado originally. So what brought you to Canada, and Dalhousie specifically?
Yeah, interesting question. So born and raised in Colorado. I went on the job market when I was all but dissertation for my PhD. And I think I applied for 5 jobs, got 4 interviews, and 4 offers. And I think it was Idaho, Virginia, Texas, and Dow. And when I really thought about the occupational therapy program here, that's where I applied for.
Right.
Philosophically, I fit best here. And then I thought about lifestyle and where I wanted to live, and I didn't want to live in Dallas. It's too big city for me. Idaho was a very small program. I think they had 8 OT students or something in a beautiful community. But this was just the right size, the right fit, and not the easiest move to immigrate into a new country.
Right.
I think I naively thought it'd just be super duper easy. And it's not as easy as you might think, but I, without a doubt, made the right choice to come here and start my career. And it's been, I have not looked back. It's been great. And I love living in Halifax and the colleagues I work with. So yeah, that's kind of the origin story.
That's great, Brenda. Now, did you apply to any other schools in Canada?
No, I didn't. This was
Okay,
it.
so Dalhousie was it.
And I knew
Interesting,
Susan
yeah.
Doble, who worked in the School of Occupational Therapy.
Okay.
We had taught assessment of motor and process skills courses. And I think she was the one that flipped me the job ad. And I thought, okay. So I knew one person before
Right.
I moved here.
Oh,
So
that's
yeah.
No, that's great.
Yeah.
So what? So you're the dean in the Faculty of Health, and so what qualities do you bring to the role of academic leader, and how would you say your leadership differs from traditional role of a dean?
I saw this question beforehand, and I'm not sure. I think both you and I were thinking, what's the traditional role of a dean? I honestly think in any faculty or any leadership position, there are different times when different leadership skills are needed. And so you might see different types of leaders be very, very successful at different times. I came into the faculty, I think, when we perhaps needed a really collaborative dean that was going to kind of hopefully lift people up, bring people together, and also one that just really loves strategy.
Right.
I love
Okay.
strategic
Yeah.
planning, and at the time we had a brand new strategic plan that Alice Aiken brought to the faculty, and it was a good time for me as a leader to show up. I would say when the first day as acting dean, talk about intimidating. You walk into an office and everybody was gathered out front, all the dean's staff, and I'm like, I am the least knowledgeable about what a dean does right now. All of these people in the room know my job better than me. And just having the grace to learn from them has been really good.
So that was back in 2019.
2019,
Was
yeah.
that 2019?
No, 2017
Yeah,
I was
the
acting dean.
Okay.
Yep. When Alice went up to
Right.
the VPRI's office. Yeah. But let me see, let's go back to the question. Unique qualities.
Yeah.
I think that the collaborative leadership where, you know, being a dean is not an individual sport, it's a team sport.
Right.
So it's working with the directors, working with the office here in the dean's office, and all of us kind of rowing in the right direction. And as a leader, charting that direction, and then giving people the authority to get on with their jobs without kind of really, meddling too much. Because we've got amazing people that can do this work, and I don't need to oversee every single step of it. So I'm very fortunate on that front. So collaborative leadership.
Right. Well, I can appreciate that, Brenda. As a director in the School of Physiotherapy, I can appreciate that sort of unique quality that you bring to the dean and the leadership role in the faculty of health.
I hope the other directors and other leaders in our faculty kind of see that we're all kind of in this together, and I'm here to support them more than, it's not about my career anymore, really.
Yeah.
It's around, let's bring everybody else
exactly.
up, right?
So, if I get my dates right, you'd start in 2019 is when you started as the dean.
Yep.
And so what would you say are sort of the top challenges? So you've been in the role for a number of years. So what are the top challenges sort of facing the faculty as we sort of head into this new academic year?
Well, my first year was COVID, so that was a challenge.
Well, yeah.
I think you were in the role as an acting director. No, you were associate director at the time. That was a challenge.
Yeah.
But I do think we pulled together, and I think my skills at the time was calm, collaborative leadership so that people weren't getting too, excited and stressed and, anxious about it. So it's like that steady hand.
Yeah.
The things we're facing now is it's great. We have a constellation of health professions in our faculty that we, programs that we teach, and our communities need those professionals. So we're in a really great spot of supporting the health of the province, supporting our health workforce. The challenge is we have outgrown our infrastructure. We've had increases in a lot of our programs. We've responded to calls from government. We've responded to calls, to support the health workforce, and we're hitting kind of capacity. And there is room for more growth given the need, but I'm not sure we have the space to do it. So that's a big one, and an expensive challenge.
Yeah.
In the ideal world, a new building, that health would share with medicine and dentistry, I think would be ideal. But that's years away.
Yeah.
So, but some of the opportunities that I see, I want to elevate the Faculty of Health as being viewed as a leader in Nova Scotia in the health field, whether it's research, whether it's academic programming, whether it's showing up at the table to have discussions on how we address these challenges. So I think we have a lot of opportunity in that realm to be a leader in Nova Scotia.
Yeah, so would you say that's our biggest opportunity? I know with challenge often comes opportunity, so are there others that you feel are
what I
for us in the faculty?
also see is we have a lot of new academics joining the faculty, and we've been really successful with recruitment over the last many years, and the research that these folks are engaging in is phenomenal. We've had really great success in some of those research and grant funding, and directly addressing some of the challenges in our healthcare system. So I think that is another opportunity that we have, is showing up and with strategies to address and the research behind it. And how do we cultivate that talent that's coming into Dow and keep attracting those folks?
Yeah. Because there's one element that where we're addressing maybe the needs of the healthcare sector from a human resource perspective. But I find one of the great parts about Faculty of Health is that there's this combination, this collaboration between the research and the studies that are used, the academics that are there to help in the workforce by supplying, whether it's nurses, OTs, PTs, social work, folks in health sciences, kinesiologists. Yeah,
and I think sometimes times to a lot of people we're an unknown entity a little bit.
Oh, right.
Maybe not as
Yeah.
much anymore, but we're one of the largest health faculties in Canada. We have over 40 some programs.
Yeah, that's
And
that's great.
so it's we're a big entity here.
Yeah.
And I think from a research and an academic programming, but I would also say the opportunities around cultivating an environment that attracts faculty and staff
Right.
and students, that we have that supportive culture, we have that engaging place that people want to be.
Mhm.
And yeah, that's an opportunity as well, I think.
That's great, Brenda. So I want to come back to the healthcare sector comments that you
Mhm.
made. And so how do you see the faculty's role evolving in response to the growing challenges in the healthcare sector?
Yeah, I think, the faculty probably always has been collaborative with government entities, collaborative
Right.
with our private and public healthcare. But I think those collaborations are growing and needing to be stronger.
Okay.
So, that how we show up, at the table, we're hearing the problems that are maybe happening within healthcare. And how can we help? How can we help either through our research or through our academic programming or in just kind of, brainstorming with folks that we're here to help. I think the other thing that is changing is also the landscape around rural practice, and how are we, trying to support students in getting to rural placements, because we know it's expensive, for them to have an accommodation, a housing accommodation here, but then go for 6 to 8
Yeah,
weeks
that's right.
and find accommodations in some of our communities. But our communities can really benefit from students doing placements there. It's a great way to attract talent. It's a great way for recruitment into those areas. So I do think there is a need for myself, probably our directors, and I know you've done this, to get out into our communities to talk about the opportunities that will mutually benefit both our faculty, our students, and those communities.
Right. No, that's great. I'm going to change gears a little bit
Okay,
to
let's
a
change.
question, because I don't know if this is figuratively or literally, but what excites you most about coming to work every day? And I see a scooter sitting here to the left of me.
Oh yeah.
Because I'm excited about riding that to work every day. But really, what does excite you most?
It is a
about coming to
joyful
work?
start to
I
the day.
I know. I could imagine that it is. At least on a day like today.
Yeah.
Maybe not in the middle of.
Maybe not in the middle of winter. I would say hands down, it's the people I work with.
Right.
Without a doubt. Unfortunately, I don't interact enough with students. I would love to maybe have that as a
Okay,
new opportunity. But the people here in the dean's office, the directors I work with, the faculty members, that is exciting. When I also have the opportunity to interview, applicants to different positions and talk about the faculty, that's what kind of gets me excited.
Get you excited. Yeah.
And I love how do we as a faculty be where we can cultivate ideas and initiatives that could spread across campus if they're working. And that's also pretty exciting. I think some others have latched onto our vacation initiatives, where we're really supporting and promoting people to be able to take their vacation, and I think we're quietly spreading that. So that's kind of fun. That's important.
Yep.
So, but hands down, people. I love who I work with.
That's wonderful.
Yeah.
That's wonderful. So how, because we do work with such a diverse group of people in the Faculty of Health, as you've mentioned, all the programs we have, and then multiply that by the number of students we have. So how's the faculty promoting diversity, equity, inclusion within its programs and research? Any comment on that?
Yeah, it's a really good question, and probably something that will be a priority for years to come.
Yeah.
This is work that takes time. So I think there are some initiatives that we're working on. Our philanthropic campaign is focused on health equity. So focused on how do we support financially students to come into health programs through bursaries and scholarships, etc. Especially those from different priority communities, our Mi'kmaq, our Indigenous, our African Nova Scotian, and Black students. But in that philanthropic campaign is also money that we've targeted for research to better understand, address, prevent the kind of health impacts of racism and other kind of marginalized communities. And we have a really strong group of researchers in this area. And so it's how can we kind of get additional funding to actually elevate that work and to promote better success in that work, and to hopefully, kind of remove some of those systemic challenges related to health. So that's, I've got to go back to the question. Oh, diversity, equity, inclusion.
Yeah.
I would also say another really key position that we've recently hired is our new Associate Dean, Equity and Inclusion, who Dr. Terrence Lewis, who's just started, and he's just getting his feet grounded in who we are and kind of where he wants to work, or what priorities he wants to work on. And he and I have communicated, and he's meeting with all the directors and kind of just getting a sense of what's going on. And then, because of how iterative and flexible our strategic plan is, we will be putting in priorities that he will be kind of leading. And these will be action-oriented priorities. As you know, our strat plan, we don't have anything that you can't action.
I know.
So over the next few months, we're going to work with him. We'll align his passions with our needs and get those into the strategic plan. So I think that's exciting. Dr. Marion Brown, as you know, has been working on universal design for learning, culturally responsive pedagogy, and really educating our faculty members in these areas to advance our teaching practice. Then lastly, this is quite exciting. We've recently successfully recruited a candidate for a Canada Research Chair in anti-racism in health and health care practice. So that person is joining the Faculty of Nursing and will be applying for that Canada Research Chair this fall.
Oh, that's wonderful.
So stay tuned. Stay tuned on that announcement. So that person will really elevate, that work, and hopefully you have graduate students working with her, etc. Yeah.